Hello everyone, my name's Liz. I am a nurse practitioner and I work with Crossroads Hospice and Palliative Care. Like I said, I'm in the palliative care role, and what that means is palliative care helps focus on people who have chronic illnesses, typically terminal illnesses, but who need a little bit more help and who need a little bit more support at home. So, an average patient for us is a patient with advanced cancer or advanced dementia, heart failure, COPD, anything like that that takes a lot of management and worsens over time. So we typically see people when they're in their late stages of their disease, or if they're having a lot of decline or struggle. It really just depends on the patient. So, what we do is we help manage symptoms, problems, whatever comes up. I kind of joke I'm a problem solver with some of my patients. So, like when we come in with an oncology patient, we obviously work with the oncology team, but we also help try to manage any symptoms that pop up. So, a lot of cancer patients have a lot of pain. We help manage those things. A lot of nausea, we help manage that. But we remain part of the team. We don't take away from anyone's care, we just add to the care they already have. So, if patients are supposed to get an echo every 6 months, if they have heart failure, they still do all those things. They can go to the hospital, but we do our best to keep them out of the hospital, manage, heart failure exacerbations and things like that. So that's a little bit of a rundown. Like I said, we don't take away from any care, we just add to it. And then, a typical day-to-day, what makes palliative care nice is we come to you instead of making the patient come to us, which is really difficult for a lot of people with advanced diseases. So we do home visits. I typically see about 5 to 6 patients in a day, wherever they are, sometimes in facilities, sometimes at home. And I just go from home to home. And if everyone's doing great that day, I say great and see them next month. And if not, we try to address the problems that they're having and we go from there. So like an average patient that I saw this morning, she has advanced lung cancer. And today she was great. She was in between chemo treatments and she was feeling well and doing well, and that's fine. Last time I saw her, she unfortunately was not feeling too well. She was having a lot of nausea, so we added another nausea medicine to her regimen and just helped manage that symptom. And so those are the kinds of things that we help do. And then another big thing that we help do is goals of care discussion. The dreaded goals of care, where, well, do you want to be resuscitated? Do you want to go to the hospital? What about hospice, when that becomes appropriate? So those are the kind of the big things that we do. It's a lot of education, a lot of support. I typically see patients once a month if they're doing well. I can come more often. Typically though, if someone needs to be seen once or twice a week, they may need to go to the hospital, or they may need to have a discussion about hospice. Like I said, it's very much dependent on the patient. I am full-time here at Crossroads, and there's another nurse practitioner that's here too. And we just work with the team, with your healthcare team, and if we have a problem, we'll call your doctors, and we treat people as they need to be treated. So that's just a little rundown of what I do. I hope that helps. And hopefully every hospice company can get a palliative care team, because there's a lot of benefit with it. Thanks, everyone.